ultimate goal is to help patients' lives. Ultimate goal is to find, where are the secrets, and who knows those secrets? It's those working day-to-day jobs. Those are in the depths of the operations of a hospital. And that's why I wanted to understand the depths of the operations of a hospital. And the nurses, some of the best ideas come from nurses. Some of the best ideas come from techs that are working in our hospitals. And we have to really rely on them to find solutions.
That we need to find the best solution to offer the best service in a better value, in a different way. And even that we are in the time of wearables and artificial intelligence and a lot of technology that can provide and help to scale this kind of service, we have to find the best solution in the time that we have. And in the way that we need to control the outcomes of the patient, I think this is a challenge for everyone.
We have to listen to our patients. We have to listen. There's a reason why we as innovators and people who are working in innovation, we have to listen to what our patient population is saying. And in the US, they're being charged for readmissions. If you don't focus on what you're being charged for all the time necessarily, and you focus on the patient outcome, then you won't have those readmissions that you're being charged for regulatory-wise. So again, we're going to see a dramatic change in healthcare, both here in Israel.
To have the collaboration, for me, the word is trust. And it doesn't matter exactly the field. If you are, we are talking about Oshrat, and we are saying the difficult part of find solutions that are really reliable. If you trust what they will offer as an outcome, the time is good, the collaboration born, and at the same time inside your team, if you are an entrepreneur or you are starting something project, if you have a trust inside your team, the collaboration will be born.
Future Hacker, Life, Path, Future.
Hello everybody, and welcome to Future Hacker. I'm your host, Maria Taiji, and today we're talking with two incredible women about innovations in the healthcare system. First, joining us from Israel, we have Oshrat Hodara. She's at the forefront of global health innovation at ARC Innovation, which stands for Accelerate, Redesign, and Collaborate, an initiative from Sheba Medical Center. She oversees international partnerships aimed at transforming health systems through digital solutions. Sheba Medical Center, recognized as one of the world's top hospitals, plays a pivotal role in global healthcare with innovations like remote cardiac rehabilitation and AI-powered diagnostics. Hi, Oshrat. It's so great to have you with us today. How are you doing?
I'm great. So great to be here. Thank you for the invitation.
And joining her from Brazil, we have Dida Capobianco, who leads health design and innovation at Albert Einstein Hospital, one of Brazil's top healthcare institutions, known for pioneering healthcare transformation in Latin America. Einstein's Health Design Lab focuses on integrating cutting-edge medical technologies and digital health solutions to improve patient outcomes. Hey, Dida, great to see you today. How are you doing?
Fine, very good to see you, Maria.
I just love to have amazing women with me, and especially talking about such an important topic, which is, future of health, right?
Yes.
So, Oshrat, let's begin with you. What led you to this role, and what has been your journey in health innovation?
So, great question. I came back, my background is in hospital administration, but initially I started in consulting. I did hospital documentation improvement program implementations across the United States. I started with that realm and was basically taken under the wing by the lead healthcare leader of the consulting company I was working for, which drove me into the direction of finding my love for working with hospitals and finding solutions together. And eventually that drove me to go get my master's. I went and got my master's in hospital administration. So I learned a little bit more in the depths of operations. And then when I moved here to Israel, one of my main goals was really to get to know the ecosystem. The healthcare system here in Israel is very different than the United States. I wanted to understand the aspect, but because Israel is a startup nation, it's known for all the startups that we have. I was very drawn to the innovation of healthcare, and I wanted to understand that more. And what better place than Sheba Medical Center? Sheba has ARG Innovation, which is the largest innovation center, Sheba being the largest healthcare system in Israel. And I met directly with Professor Eyal Zimlichman, and found this amazing role that really lets me interact with partners across the globe. One of our partners, which is Albert Einstein, great partner, finding solutions together, really drawing, coming together to make this global impact that we're really trying to have. That's really Sheba's goal, ARC Innovation's goal, is to have a global impact. So my career started, not really knowing what I wanted to do, but then healthcare has always been a passion of mine. This is where I am, and I love it.
Just a curiosity. So, healthcare has been always a passion of yours. Do you have any family influence on that or not?
I do. So I always say that when I considered doing medical school, my stomach couldn't handle it. So my dad's a pediatrician. My dad, when I was a child, I have vague memories of my dad taking me with him to the hospital to do his rounds. He would go visit all the newborns and the preemies. And the interaction he had with the nurses and the staff there, something about it just drew me in. There's so much optimism and so much, just wanting to help people, wanting to find solutions, wanting to help together as a team. My dad couldn't do it alone. He relied a lot on the nurses. And that really drew my love for working in healthcare. Ultimate goal is to help patients' lives. Ultimate goal is to find, where are the secrets, and who knows those secrets? It's those working day-to-day jobs. Those are in the depths of the operations of a hospital. And that's why I wanted to understand the depths of the operations of a hospital. And the nurses, some of the best ideas come from nurses. Some of the best ideas come from techs that are working in our hospitals. And we have to really rely on them to find solutions. So that's
absolutely love that. So what about you, Dida? Just share with us your journey.
I'm a speech pathologist. So I started all my studies trying to offer the health service. And I was studying neurology and cancer after my graduation. And I was working in the hospital. But I noticed that every time that I started to work with the patients was not enough. And I had that dream that I can change the world and everything alone, just me. And I started to arrive before to solve the line of the hospital. And every kind of patient that couldn't be attended in that day, I said, no, come together. I will try to start a little bit early. And I was working more than what was usual for me, just trying to solve a problem that was a systematic problem of the hospital. And after a while trying to do this, I noticed that it would not work for me, for my health. And when I started to think about my work as a speech pathologist with cancer, neurology, I said, it's my time and the patient time. I cannot scale this kind of service. So how I can help more my country or the patients and solve some problems like the line inside the hospital. And when I started to think about that, innovation was the solution, because it's a way of life when you can see the problems, but see opportunities behind the problems. And I started to think about what is the opportunity here. And I was not desperate, but I was very, very reflection about how to offer service care. And when I was studying, teacher from United States came to Brazil in the day of my birthday. And I said, is a sign. I need to understand in a different way how to offer this kind of service. And I was studying a lot in Brazil. I was an editor in a journal in Brazil, and I say in Brazil, I think I know a little bit. Of course, we need always to learn more. But I said I want to know how they do the service in the United States. I want to know more in a different perspective. And when I went to that lecture that was in my birthday, they said you cannot get in. It's very we have a lot of people. We cannot. We don't have any gap again. Like you need to do the registration, and it's not possible anymore. And I said, but look, it's my birthday. I don't want the certificate of this lecture. I want to have the knowledge. So please let me in. I don't care about the certification. I went to that lecture, and at the end, I was talking with that professor that is from Duke University. And I said I would like to know more about the innovation, about the research and research process, how to merge all these to scale services in Brazil. So can you help me give any kind of tip? And he said, I like your way to come and talk to me. So I will give you my card and let's schedule a meeting. When I scheduled that meeting, I didn't understand that I was really changed a lot about my career, because I was a speech pathologist inside the hospital trying to offer service, but I didn't have any kind of background in innovation. When I went to Duke University to study my PhD, that because of this lecture, I changed what I was offering here. So when I returned, I changed my PhD that was in clinical services and speech pathology, and I changed for innovation. So I started from zero, and I think this was the first lesson that I had. If you want to do something, you need to have the courage to start it again. And I have a lot of stories of failures too. That I don't know if this will work, but you need to understand when is the time to stop. And I stopped in the middle of my PhD something, and I started again. And when I started again, I had a new kind of opportunities in front of me. That is what I'm working today.
I absolutely love that. You're all somehow bitten by this bug that you just can't accept the status quo and you just keep searching, right? One thing that you mentioned, Oshrat, you mentioned that the healthcare system is very different in the US compared to Israel. I'd like to learn more about it, but more than that, there's this shift, and I believe globally, of this volume-based care to a value-based care, right? And that's a hot topic. In many countries, there's this healthcare crisis because the cost is too high. It's really hard to the system is, a lot of things there are wrong in there. So, what are your thoughts on this shift, like from the volume-based to a value-based system, and what can be done to ensure that at the end, it's whatever happens to the patient outcomes that is going to be prioritized, right? And not how many surgeries or how many exams and how many appointments a person has.
Absolutely. I couldn't agree more. I think in order to improve the healthcare system, whether in Israel or in the United States, a value-based system should be a priority. Really holding our clinicians and our physicians and everyone accountable for the care they're giving. Instead of giving the 5 minutes, okay, here's a prescription and walk away, get to, understand the patient, understand the clinical needs of the patient, understand, the deep down, there could be more in there. And a lot of times there's errors made. And why are errors made? Because sometimes if the volume is too high, that physicians are seeing, and could increase the errors that are potentially made. You want to hold these clinicians accountable. I mean, they're doctors, they're given these degrees for a reason. At the end of the day, the patient outcome is what is the most important to anyone. You sign as a physician, as a tech, anyone. Ultimately, you're trying to provide the best patient care. One of the areas that really interests me is patient satisfaction, and I think that aligns well with patient outcomes, because a lot of times, maybe the patient outcomes is not as great, but their satisfaction of the care they got and they received could be a lot higher, and that can improve their ultimate how they're recovering. The way the patient feels, the way for the patient, people don't understand the impact that has on the patient themselves. If they feel that they're getting the best care, provided the most amount of time with a physician, the physician is actually listening to them, cares about them, understands their needs, understands, some of their comorbid, some of their previous conditions that they've had. They do well. They do well. And that's one of the reasons why we're also heading to home care, is because patients recover better in a home care setting, because they're in their setting, they're in their environment. They feel that when the physician comes to them or the nurse comes to them, they're getting that one-on-one service that they don't feel they have in a hospital setting per se. So the value-based care is so critical. The direction, it's going to change the way we view healthcare dramatically. Hospitals are already heading that direction. We say that it's the future. It's not really the future. We're in the future. I'll give you a personal example. My mom was admitted in the hospital, and she had pneumonia here in Israel. And you asked about the differences. She's allowed, in the U.S. hospital, after a day or two, there's turnover. They're trying to get the patients out because of the inpatient. They need the beds. Here in Israel, it's a little different because of the universal healthcare system. Obviously, they want the patient to stay until they're better. But if they can provide a better service, like a home care setting, that they can provide that inpatient stay, but in a home care setting, then they will. And the hospital she was staying at did provide that for her, and she recovered dramatically. It was night and day. Once she literally said to me, I want out of here. I want out of the hospital. And she went home and she got better. And what we have to understand is we have to listen to our patients. We have to listen. There's a reason why we as innovators and people who are working in the innovation, we have to listen to what our patient population is saying. And in the U.S., they're being charged for readmissions. If you don't focus on what you're being charged for all the time necessarily, and you focus on the patient outcome, then you won't have those readmissions that you're being charged for regulatory wise. So again, we're going to see a dramatic change in healthcare, both here in Israel, in the United States. The U.S. really, one of the reasons that drew me to Israel is the universal healthcare system. I just see such a difference in the way care is provided here. In the U.S., people are afraid to get care because they have to pay for it.
Yes,
they have to go and they say, oh, I don't want to go to the ER because I have to pay a $300 deductible.
And I don't know if this number, I don't know if this is still updated. I know that a decade ago, I think it still is, like the top reason for people getting broke in the US is because of health issues, right?
Healthcare. Yeah. It's significant, and how much people out of pocket are paying. It really is. So I'll let Dida go ahead and answer her perspective from Albert Einstein, because I know in Brazil, it's also very different. And that's what I love about working with our international community, is because we learn so much from each other. Like what is working for you and what is working for us. So I'd love to hear your perspective on this, Dida.
Thank you. Here is different from US and is different from Israel. We have a very good public system here. Of course, that if you had private insurance, you have a different time to manage your health. So here we can offer both. But the health public system is really, really good, even in a very huge country as Brazil. So this is one thing that we are very proud of Brazil in the way that we can offer this for the society. It's not perfect as anything will be, but is good enough. And we need to solve a lot of things, as Oshrat was explaining. The value of health and the way that you provide the service is not a problem in Israel, Brazil, US, is in all places. Is really, and I was thinking, what is the real motivation behind that? Because one of the articles in my PhD during the time that I was studying this was the volume outcomes of patients that was in surgery for SALS, the apnea obstructive sleep. And when we were studying that in US, in NIH, we are seeing in a federal point of view what was causing the increase of price for the surgery. And there is a lot of things that can be in this equation. Even that is the experience of the physician or the way that the center is organized. And it's difficult to understand when you are sick where you will find the solution. And you are going to the wrong place, you have high prices. So we need help. And when you need help, you don't have a lot of time to think about. So you go in the first option that you believe you will solve. And it seems it's something that is not exactly what you work sometimes, or you don't know exactly what the physician is study all the time to offer you something that is about your life. You just trust. So different from a lot of areas, you need to trust a lot that you are in the best option. And when you don't feel, maybe you are in the best option, but with lack of empathy, you don't know. And you say, I don't know if this physician is doing the best for me. I need to change. And you start a cycle, and a cycle of find another service, find the best way. I think I'm in the best option now. I love someone and I want to see them good, and I want to see them good fast. I will not take the chance to wait. And this started this cycle that you are trying to find better options, and you are disrupting the cycle of service. So I think we have a lot of challenge inside in the middle of all these. But one thing that in providing a service that is, as Osha was saying, look at the patient and see what they need, what they really need, and what they are willing to pay. Even like doesn't matter exactly what is the problem. Like you can have a service that with a high cost for some kind of patients, but they are willing to pay that. They can understand the value behind the service that you are offering. I think this is something difficult to measure. Like I can measure cost, I can measure the time of the doctor, I can measure the length of stay inside a hospital, but how can I measure in a good way the willing to pay, the what any kind of patient is really satisfied, and satisfied is good. I don't have any problems, like they are not complaining, but they are willing to pay more for that. How much they think is worth it, that kind of service. And this is a difficult topic for everyone, and a topic that passes through us, because when you understand, take out the medicine field of your mind. Like I have teenagers at home, three teenagers at home, and you say something, and we are in a dinner table, everyone, but who is really there with you? Like in the time, not doing a lot of things at the same time. And these, a lot of things at the same time, feel that you are very productive. But at the end, you are making this cycle longer. Because if you were doing one thing or in a simple way or with all your heart attention, maybe you'll be faster and maybe you'll be better to provide that service or to have that time in your table at dinner time. And I think it's not just about health, it's about society, it's about the human being, what we are doing with the time that we have in our hands and how we are offering this. So in health, you can feel more because everyone is like, I really need something, I really need now. But this is for everything. Like take out the Wi-Fi in your home and see how they will feel. I want the Wi-Fi and I want now. I need to do this, and that. So I think is a challenge that we need to understand that society.
Absolutely. And I love that both of you brought two things here to the discussion. So first of all, empathy, right? And I just did is I think we're going to release it next week, October 1st. And I did a roundtable about health literacy, and it's amazing how empathy and communication skills, like between not only the doctors but the whole healthcare system to the patients, only that improves dramatically the adoption to the treatment, right? And that's exactly what you're talking about, right? And then it also made me think that sometimes, I mean, many times, it's not just about the symptoms, diagnostics, and the medicine you're having, but also the mental health that has everything to do with that. And the example that you gave about your mother, Oshrat, that she needed to go home, and she was able to get all the system to help her on that, and to have the home care, how this alone already helped her recover that. And that situation that you used as an example already tells me a lot regarding the future of the healthcare system. We know that the future is focused on prevention, right? It's focused on personalization, right? And in being less invasive as possible, but also about being able to provide people the care in their environment. And I think it's amazing if we are able to get there. So I'm curious, is it something, what's the financial impact? Like, do we know and can we already prove that by giving people a home care access is it has a positive financial impact? We know that it has a positive impact on the health of the person. So, but do you know that does it decrease recurrence? Do we know that already, or is it still a cost that we have to invest until it's something feasible?
So I think we have to take it from the stance of when you provide home care, you're starting to explore innovative solutions that are home-based. And when they're home-based, they're more in the sense of wearables, medical devices that are wearables that are able to monitor a patient. And this is where the startups come in play. So when you talk about cost, it depends on how these startups are valuing the medical devices that they're producing. Obviously, they're looking for a low-cost product. They're looking to produce at a lower rate. Obviously they have a profit. They want to make a profit. But when you sell to a healthcare system, or if you sell to a larger community, the prices can come down. So in terms of cost, I think that it shifts from the inpatient setting to not an outpatient setting and a home care setting, where, outpatient setting can be still quite pricey, because you have your larger equipment, your larger EKGs, everything that's being used. But if you're looking at these medical devices that are being utilized, that are handheld ultrasounds, handheld EKGs, and that's the direction we're heading in. Look at the smartwatches we have these days. They can monitor you. When you talk about invasive, so at a home care setting, you would still need to come inpatient to do an invasive procedure. But now, even the cancer centers, I know we're considering and we're looking into potential of doing infusions at home, which has not been the case. It's think about not only the sense of the patient recovering, they're not exposed to the unnecessary bacteria that they can be exposed to in an inpatient or an outpatient setting. They're in their home care setting, a home setting. So that's where you take into account, it could be, in that sense, it could be pricier to move it to a home care setting, but does the satisfaction and the outcome, patient outcome, outweigh that? What outweighs? And that's when you say to yourself, do the pros outweigh the cons? Granted, there's going to be an associated cost, absolutely associated cost, but where does the cost lie? In the inpatient setting, think about all the equipment in one inpatient room, all the equipment that's being utilized for that patient, and you move that into a home care setting, and it's condensed to a wearable or to other monitoring medical devices or other equipment that can be used. Yes, I think there is potential, and I obviously haven't done the research on it, but it'd be very interesting to see that comparison. What is the cost of an inpatient in the U.S., in Brazil, in Israel, versus an inpatient setting at home, based on the equipment and technology being utilized? So I still think invasive procedures need to be thought out very carefully, because you do take a chance on a patient outcome and what can happen. And so the reason why they move it to an inpatient setting is so that they have that backup. If, God forbid, something was to happen to the patient during the invasive procedure, they have the staff resources to be there to react right away. Whereas at a home setting, you don't have that. So you have to take that into account. But I think we are moving towards, and I think it looks like that the costs, it will be a cost reduction. I foresee that. I mean, most of these companies are looking for the best low-cost ways of providing the best care for patients. So that is innovation in a sense, is finding the best technologies out there at the lowest cost possible, that you can promote it to companies and at a bigger span and scale it up to other hospital organizations.
That's perfect. And Dida, I'd like to know your thoughts, but I'd like to also add a follow-up question on that. Whatever you'd like to add to Oshrat, but also just like in ARC, you're exposed to a lot of startups as well. And just as you mentioned, that we're increasingly seeing many solutions that are focused on being not only more efficient, but also prioritizing patients' comfort and also the speed of results as well. So if you could share as well a couple of solutions that you're seeing here in Brazil, and for sure I have the same questions for Oshrat as well, what you're seeing around the world in this direction. So Jid, please.
Yeah. I will just add something that I totally agree with Oshrat, that we are in this transition of how to offer the service, and we need to find better solutions. And I love the way that you put, Oshrat, that we need to find the best solution to offer the best service in a better value, in a different way. And even that we are in the time of wearables and artificial intelligence and a lot of technology that can provide and help to scale this kind of service, we have to find the best solution in the time that we have. And in the way that we need to control the outcomes of the patient. I think this is a challenge for everyone. Like all the startups that we have here and the solutions that we have a lot of things in wearables trying to make this transition in a better way. But the challenge is how I offer the gold standard service. And the startup, they are in a way trying and learning how to offer the best, but they are not the gold standard. And this transition is very challenging because it's not a plug and play solution. It's not something that you were just a plug and play and started to use as we would like to believe. And doesn't matter what is the solution. The solution need a time to mature, to understand how to achieve the standard of service. And this time that in all industry, we know that innovation is about learning, is a process of learning. But how can I separate the time of experimentation and trying and testing from the time of offering the best solution? So this kind, I think, is something that we don't talk a lot. We don't talk about the time of the when that startup achieve the sense of trust. I really believe that I can put my patient, my family, my son, my husband in the hands of that new technology. That seems very good, but with my son, maybe I prefer to be inside the house. But we know, and we have a lot of research, Maria, as you asked before, that prove that everyone try to make smaller the time inside the hospital because it is really high. And as Osha was explaining about her mother, it's something that nobody wants. Even that you offer an amazing kind of environment, is not the comfortable and the best option as your home, inside home. You can have a very different experience with the health service in a different environment. So I think we are in this transition, and this transition is not something that will be for a short time. When any kind of new technology will pass to the phase of achieving the outcomes that we need to say that is saved, that we want. And you can see people trying solutions when they don't have options. When you go in a research that is trying something very different in the market, you say, look, is my last option, so I will try. And innovation is starting in some points. Or in the other, is not something so bad for me, but I'm willing to try this something new. So I think this part of experimentation is something that we need to learn a lot. How to make better the time and shorten the time of experimentation, new technology.
So, Dida, I understand and I see all the complexities involved, especially when you're talking about the healthcare system, because there's so much at stake when you compare it to technologies in other sectors, right? And you always, as a startup, you have to be proving yourself and testing in smaller environments and increasing until it's safe to test. But at the same time, thanks to technology, we are being able to speed up that process when we compared. So one of the people that we interviewed, he's also on the Future Hacker Network, is Professor Cesar de la Fuente. He's the head of machine biology of UPenn University. And he's been explaining and lecturing through the whole world how he's being able to use artificial intelligence and machine learning to search for new antibiotics and doing things that we as humans would take centuries, right? And he's being able to, through technologies, be just for, but still you have this whole phase of, okay, we found out, but now more decades to go to market because you still have to go through the whole testing phase. Like we still can't simulate a human being in a machine yet, right? So Oshrat, I'd love to know your point of view.
Regarding the AI driven.
No. I mean, regarding what Dida said of those complexities of being able to be supporting startups and also and those like, when are you ready to go? When do you have to wait? And when it's safe to move on?
So one of the things, and I know this comes up a lot, is the idea of how reliable is AI and how dependent are we on AI? With ChatGPT, we saw how quickly it swarmed and everyone started using it. When it comes to medical products and medical technology, I think we have to be we have to accept it, but we also have to question it to test it. That's how you're testing the market. Our products, any startups that are in the market, there's some areas that are more inundated, whether it's, wearables that are for children, for parents that need technologies used, or cardiology, EKGs, or something, home-held devices. We have to be very careful to say that it is AI driven. It's not AI driven. The terminology AI driven, it's AI empowered, because I think when you're saying that there's still a human being behind the idea that it's not a machine taking care of you. This is a thought, clinical research being done. It's being AI empowered. It's driven by the clinical team that is wanting to find a quicker solution, because they know that through the AI algorithms that they're able to come up with, they can find a solution quicker. So it's our dependency on our new terminologies that we're using, and we have to define it better. In terms of the perspective of what we're offering, again, I was saying some areas are more inundated. Some areas in the healthcare sector, you don't see. Obviously, there's a lot more startups that are in the surgical, area sector, but you don't see it as much because, you see it, but it's more inpatient setting. So a lot of the outpatient setting and home care is what's driving the market. But yet at the same time, what are you looking for? You're looking for solutions throughout the entire hospital system. You're looking for solutions that are able to, within the digital health world that we're in, the new market that we're in the hospital setting. We want to be able to provide, whether it's voice activated technology that we can come up, instead of being so dependent on electronics and printing. Can we rely on voice technology that allows us to reduce, one of the biggest areas of concern is reduce burden on our clinical staff and our nurses. So I think that I agree that there's this idea that we're in the future already, but we have to be able to say to ourselves, we're relying on it, but not be so dependent on it. To come up with the best outcomes, to come up with the best solutions, because we still have to question these products. That's why the testing, our patients are testing in. We don't want to put something out there too soon that we're risking the patients' lives or the patients' mental health or their stability and their general health. Just because we want to go to market faster. We have to be very, very conscious of that. But I agree with Dida that it takes that clinical research, takes that time. But again, behind that AI-driven data, AI-driven is AI-empowered. We're AI-driven by empowered by the product, but it's driven by the clinicians and the team that's supporting it. So I find that very, very hard for some to believe, and it's a trust. We're exploring the idea with another partner about how much can we trust these products? Some of it varies by generation. Our older generation is not as keen to using electronics as we are and technologies. They think about, I'll give an example, like the remote control. That was a huge innovation back then. But to elderly who don't use it all every day, it's still challenging for them. So when you give them a product, an healthcare product that they have to use on their iPhone or use on this, you have to understand that their trust in it, that's not the healthcare they know. That's not the healthcare. So you have to know how to market it to that population if it's going to address something for the elderly population versus a younger population. So those are my thoughts on that.
Yeah. So Dida, feel free to add anything you'd like, but I already want to put my follow-up question out there. So when we talk about innovation, it's all about collaboration, right? So since the beginning that we're here talking about innovations healthcare, we are talking about startups, we're talking about other sectors within the hospital. So we can't innovate as much as we're talking about simple ones, right? It doesn't need to be a high technology thing. Innovation can be just changing simple processes to make it better somehow, right? But still, you need collaboration. And you both feel free to question what I'm going to say. But as much as here in Brazil, Brazilians are very creative people, right? I don't think we are the best reference of collaboration when you're talking about other sectors as well. Like companies, we usually think we have the secret sauce and we hold the secret sauce, and we're not as good as, okay, let's share, let's work together, let's collaborate. It's something that is a little more challenging. And the few I know about Israel, you have this super startup environment. I would guess that collaboration would be easier there. So my question is to Dida, you've been working with a lot of startups and other hospitals as well. Like Einstein has this great ecosystem for innovation. So how do you see, what do you find like the key components to ensure successful collaboration, like that people have the same agenda and the same goal? And to Oshrat, like you have this global vision, like you're working with many different countries, which should be even harder because you have not only different systems, right, and different agendas, but culturally, like it's even so. I think that within one culture is hard enough. So how do you see, what are the key components to make this global effort work successfully? So Dida, if you could begin.
Yes, it's a very good question, Maria. And I have one word that I think will resume and simplify the answer. Like how to have the collaboration. For me, the word is trust. And doesn't matter exactly the field. If you are, we are talking about Oshrat, and we are saying the difficult part of find solutions that are really reliable. If you trust what they will offer as an outcome, the time is good, the collaboration born, and at the same time inside your team, if you are an entrepreneur or you are starting something project, if you have a trust inside your team, the collaboration will be born. If you are in your relationship inside your home and you have trust, collaboration to raise your kids will be born. So for me, trust is something that will really start all the process of collaboration. Why we don't have a lot of collaboration? Because in a lack of trust, if you are in a relationship of business between the investor and the startup and all the stakeholders that you are not feeling totally comfortable, for sure, the collaboration will be a problem. And these all the time will bring the same kind of problems in different perspective and in different environments. But I think trust is the point that we need to
But
pursue.
there's so much around building trust, right? Because to build trust, then you have to have a safe environment. People needs to feel safe to make errors. People need to feel safe to give their opinion. So there's so much around that. So that's wonderful that you went straight to the point. Oshrat, what's your view?
So ARC innovation, the C in ARC is about collaboration. So we want to accelerate our innovative ideas by redesigning healthcare. And how are we going to do that? We're going to do that by collaborating. And the way we look at it is we look at it collaborating globally, not only within Israel, but also collaborating outside of Israel, because I feel like there's a lot to learn. Sheba has a great deal of knowledgeable, intelligent, innovative, incredible people. But we do know that, collaborating with other institutions and other organizations that are going through the same issues and problems that we're dealing with, to share those ideas and come together to find a solution together and put the minds together. There's nothing greater than that. You can't just look, it takes a team to accomplish anything. One, I agree that it takes trust. But as you mentioned in the beginning, Maria, it's very much understanding the cultural differences. Because when it comes to running a business or running an organization, the cultural that you're imposing on your employees, the culture that you're bringing into your healthcare setting, what kind of culture are you bringing? Are you providing the sort resources for an innovative culture? Are you providing the technology, the resources and the clinical experts? Are you providing that to be able to collaborate? So that cultural difference is key, because when we want to collaborate with another institution, we know that they have experts that we may or may not have. Maybe similar within a similar area of interest, but their interests may vary a little bit. And then from that, we can find solutions together and say, oh, I never thought about it that way. Let's explore this together, whether it's cancer, oncology, cell therapy, mental health. How are you viewing it, and how can we, as not just our organization, but collaborate with our systems outside of Israel and Sheba? And the reason why our goal is really to make that global impact, because as Ayaz says, we're not going to be able to do this alone. If we want to change healthcare, if we're going to change healthcare in general, if we're going to ultimately change people's views, change the potential of there being innovative solutions adopted, in a much quicker, with a short timeline of clinical studies. If we want it, we have to work together, because it's going to take us really pulling together as a team. And one of the things I can honestly say is developing those relationships. When you talk about collaboration, I always, when people ask me what I love about my job, one of the things I love about my job is developing that relationship first and foremost. And that creates the trust, Dida, as you mentioned. Developing that relation, saying, you know what, you're going to email me, I'm going to provide you the information you need, and vice versa, I rely that you're going to provide me that information. And not saying, oh, I never heard back, or this and that. It's that trust, that relationship that's being built. And I can honestly say that those partners that we have within the ARC Innovation, our ARC Innovation is built on that relationship building. They know that they can come to Sheba, and they know that they can depend on us to provide them the information that they're looking for, because of that very important word of collaboration being in our mission statement and our vision of what we ultimately want to do. There's barriers. There's a lot of barriers. There's language barriers. There's cultural barriers, as we talked about. There's system barriers, technology barriers that we talk about, and the way things are interpreted and adopted. And our clinicians won't ever accept this, or our clinicians, sure, we'll accept this. So as you mentioned, here in Israel, yes, we do adopt things faster. It is easier. Why? Because their mindset, it's all about the mindset. Our mindset is set differently. We're open to thinking outside the box. And sometimes when we're collaborating with others, we're trying to convince them that let's think outside the box together.
I absolutely love it.
So,
no, go ahead.
That's it. That's it. It's just like Dida said, it's building that relationship, building the trust. The world is the sky is our limit. If we base and work together, we always, when it comes to healthcare, people ask us, how are you still doing it in such a difficult time in Israel, for instance? Nothing stops Israel. Israel, healthcare, politics stays out of healthcare. We don't get politics involved in healthcare because we still need to find solutions for our population and make that impact globally. So we move forward. We work together, and we want partners to do so, and really do value those partnerships. So yeah.
Listen, if I could, I'll be talking with both of you the whole day, really. And Oshrat, you need to make a promise here, and we're recording that. So next time you're in Brazil, you have to let us know, right, Dida? So we can go out for, for a coffee, for a pizza, or for a feijoada with caipirinha, which I'm a fan of the third one.
Absolutely.
And so please let us know. It was such a pleasure talking to both of you. Thank you so much for sharing such a valuable knowledge. And, I hope we can still do a lot of collaborations together. Thank you so much.
Yes.
Thank
you, guys. Nice to meet you.
It was very nice. And I love the way that you finish, Oshrat, because in this exactly time that maybe can feel challenging is when I believe we will start a lot of things.
Yes.
And innovation.
Oh, absolutely.
And I think the way that you said, like the collaboration and how we can put people together with the same purpose. And I think this is very easy to find new technologies, opportunities, and service and innovation. Doesn't matter the country, doesn't matter where.
Yep.
So please let us know when you come to Brazil.
Yes.
Maria would be really glad to meet you in person.
That's for sure. It was a perfect ending.
I would love that.
Thank you. Thanks so much for watching, everybody.
Future Hacker. Life. Path. Future.